a long way from the horror unfolding at home.
A lot of people lost their home, belongings, what they work for. We need to keep calm, be together.
For the second time in as many months, Daly River residents receiving no warning of the massive flood that was about to hit, and then given just minutes to flee.
It just snuck up on us. No one was prepared for it. There was no warning, and that's the frightening thing. There was nothing in place, so it was all a rush.
For decades, there's been conversations around moving the natural disaster-prone community to higher ground. The sheer magnitude of this flood has become a catalyst, renewing calls to get that done or to build an evacuation centre closer to home.
Instead of waiting for it to be on top of us, there needs to be some sort of thing in place that, alarm goes off, a warnings or something prior.
Move the whole town, take it away somewhere else, on the higher ground. Keep us safe from coming here.
The experience in Darwin adding to the trauma.
The bloke turned up with his 2 samurai sword. People were scared in that building. People was running out the back door, and they can call you anything. They could be driving past and just, saying something at you. It happened.
Police say it won't be tolerated.
It's never acceptable for people to be exposed to racist, derogatory, intimidating, threatening behaviour. It never is.
Hoping to get home as soon as they can. Courtney Barrett Peters, ABC News.
The Northern Territory Government has announced a $100 million flood recovery fund, promising to build back better as the Defence Force finally begins assisting with the mammoth cleanup task in Katherine. Roads, bridges and an extension of Katherine's levee system are all on the table, but some locals think there should be equal attention on floodproofing homes.
Katherine cleaning up under ominous grey skies as the NT government pledges $100 million for the rebuild.
There's a number of ways in which we can do things to build back better.
The focus, public infrastructure like roads and bridges. The Chief Minister also floating an extension to Katherine's levee system.
Can we make that levee higher, stronger and work even better into the future? These are all the types of infrastructure projects that are on the table.
The senior bureaucrat appointed to run the fund today touring Katherine.
We need a plan and we want to make sure we spend the money wisely.
Yeah, I don't think enough people are collectively on guard about how to rebuild sensibly.
Gorge Road resident Ben Lewis, who's been helping neighbours clean up, wants to see homes rebuilt with floodproof features.
They can change from gyprock to another covering that's more flood resilient, like fibre cement. At the same time, they can shift their power points up higher.
He says government incentive schemes, similar to ones in Brisbane, could make a big difference, especially for people without insurance.
If you're not insured and you're out of pocket, then, you're probably thinking, you're obviously in financial stress and you're not going to invest that extra dollar to change the way your house is.
Meanwhile, the Defence Force has begun assisting with the cleanup.
Maybe they are late to the party, but at least they came.
A welcome development for volunteers like Ben Hockey, whose relentless sandbagging has been widely praised.
Uncle Ben in his truck with his sandbags.
Adrenaline's still pumping, but I think for some people it's definitely a relief, and it is we can go to sleep with peace knowing that, like you said, Calvary's here, help's here.
And for the policeman behind a now world-famous rescue, a joyful reunion with the family and dog he saved from raging waters. A moment of light in tough times for Katherine. James Elton, ABC News.
Ongoing disasters across the NT are putting intense strain on the Territory's health system, and emergency departments are at capacity. Olivana Lathouris joins me now. Ollie, what more can you tell us?
Good evening, Carl. Well, code yellows have now been called for Royal Darwin Hospital, Palmerston Regional Hospital and Alice Springs Hospital. So what that means is that each of those hospital systems are now under significant pressure. They've all experienced a rapid influx of presentations to their emergency departments, and that of course is because of the number of people that are now currently in our regional centres who have had to be evacuated from various communities or have had to leave their homes because of this flood disaster. Now, hospitals here in Darwin are not only having to deal with all these new patients, but they're still dealing with existing patients who were transferred here from Katherine, for example, when that hospital had to be evacuated. The CEO of Northern Territory Health, Chris Hosking, did speak to our local radio program a little earlier this afternoon. Take a listen.
When we called the code yellow earlier on today, I think we had more than 20 patients double bunked in our ED. Every hospital bed was full. We had taken over one ward in the private hospital in order to care for the patients extracted from Katherine, and there were still another 50 people waiting in the waiting room at ED to be seen.
So, Carl, that paints a little bit of a picture of just how much strain the health system is under currently. Now, part of this code yellow is that there are systems in place in the hospitals to prioritise patients, but people in the community are just being urged to contact urgent care clinics if they're experiencing a non-urgent medical situation. Of course, if it is an emergency, of course, still dial 000 and request an ambulance. Carl.
Thanks, Ollie.